Hi, I'm Dr. William Schneider. I'm a holistic physician. I have been in practice for over 20 years. Over that period of time, I've discovered that there are three essential questions that every patient needs to consider before making any health-related decision. I'm not going to waste your time with hyperbole. Let's not beat around the bush. These three questions are too important. If you listen to what I have to say, I can all but guarantee that you will have a better healthcare system and it may even save your life. I'm not only going to divulge to you these three questions, I'm going to explain them to you and how to use them. You see, you should never enter a healthcare system, a physician's office, or any health practitioner's facility without having these three questions ready. Too many people rely blindly on the advice of their healthcare practitioner. Whether you know it or not, all individuals, including healthcare practitioners, are biased. We are all biased towards our own personal belief system and because of our prior training. Ask these three questions and you will know the truth and it can set you free. Okay, now, hold on. Understand this. Only when you are done watching this entire video will you have a full grasp of the value and the impact these questions can have on your health and your life. For that to happen, you are going to have to agree right now to watch this entire video. It is only within the scope of the complete video that you can obtain the full understanding of what these questions can provide and the value they possess. I am going to help you understand how to moderate the harshness of these questions as we proceed. Do not prejudge the usefulness of this first question. The first question is, can you promise me you will not kill me? I know, that's pretty dramatic. Watch the rest of the video. I'm going to help you understand how to ask this question and develop a closer relationship with your practitioner. Question 2. Can you promise me you won't make me worse? This one is not as harsh, however. It also needs to be presented in the right context. And your third question is, can you guarantee that the treatment being provided is going to result in me being healthier? Before we go further, let me assure you that there is a form of healthcare available to you. And when you ask these same questions, the answers to each and every one of these questions is a resounding yes. And you know, whether your knowing comes from analysis or from intuition, that this is the type of healthcare you should have. Your healthcare should focus on correcting, repairing, restoring, and healing. You should be correcting the underlying problem, repairing the damage, restoring the function, and healing your body. That is what we do at the Pain and Wellness Centers, and that is what you deserve. Don't let an antiquated, old-style healthcare system stop you from obtaining the results you desire. Isn't it about time you upgrade your healthcare model to a modern, holistic approach? Okay, let's talk about these questions in a little more depth. First off, you haven't been exposed to these questions before because of the volatility of them. Listen carefully and listen to the entire explanation, for I will help you understand how you should ask these questions. In so doing, you can reduce the likelihood of confrontation, and therein lies the reason these questions are not addressed. When you first hear them, you might even feel uneasy and hesitant to ask them. However, let me assure you, it is in your best interest and the interest of your loved ones, and the interest of your health, and the interest of your future well-being to always ask these questions. And never make a health-based decision until you have your answer. You do want to be careful with respect to how you present these questions. You don't want to insult or create a confrontational relationship with your healthcare practitioner. You simply want to make sure that they understand your concern and address you in an informative, helpful fashion. Once you have the answers to these questions, you can confidently make decisions, for you are informed. Discussing these questions with your healthcare practitioner can also help to form a better relationship. If presented properly, these 3 questions can actually help to reduce the stress experienced by your healthcare practitioner. For they know they should be covering this information with you. However, it is often left to you reading a form with fine print on it, or you are expected to learn this information on your own. That is why I am providing you with this information today. Actually, you may have never thought about these questions. You deserve and you can have all the information necessary to make an educated, well-informed healthcare decision. You can take charge of your health. You can avoid uninformed decisions. You can prevent the leading side effects and dangers associated with many procedures. You can reduce your chance of being one of the many medical mishaps. Okay, so let's analyze this first question. Well, it is one that I am sure you've never asked before, at least not out loud. You may not even want to acknowledge the importance of this question. However, you need to know the answer to the first question. And once again, the question is, can you guarantee that you won't kill me? I am sure you will agree. This is a pretty important question. However, maybe you wouldn't ask it in just that fashion. You may not want to blurt out, can you guarantee you won't kill me? Obviously, that would be confrontational. Think about how you would react if someone asked you that question. No one is going to intentionally kill you. No healthcare practitioner considers what they do to have a direct effect on killing someone. However, there are many procedures and medicines that can result in just that happening. Did you know that over 2,000 people die every year as a direct result of taking aspirin? How about non-steroidal anti-inflammatory medications like Advil and Aleve? There are over 15,000 deaths a year associated with their use. So, asking this question can provide you with information that you may or may not want to know. And I'll bet you, knowing the death rates of these common medications will have very little impact on you. I find that to be one of the most alarming reactions a person or a patient can have. If you do not find this information to be shocking, you are probably way too comfortable with side effects and dangers of most medical procedures. If you analyze this information from an objective point of view, you may not be as comfortable as you are now. You may even respond more rationally. You might even become concerned. You might question the safety and legitimacy of using medications. Think about it this way. What if there was a vitamin on the market? And a lot of people are using it and getting pretty good results. You may even have used it. Then, one day, a report comes to your attention that last year, over 15,000 people died from taking that vitamin. What do you think your response would be to this news? I'll pretty much guarantee that your response would be much different than the one you had to the medication. The statistics are the same. However, most people respond dramatically different. I'll bet you would never take that vitamin again. And you probably wouldn't just stop there. You'd probably tell all your friends. You'd probably post it on Facebook and Twitter. You may even go as far as to call for the removal of that vitamin from the market. Now, isn't that interesting? Two polar opposite reactions to the same news. The only difference is you have not been made comfortable with the idea of dying from a vitamin. Ask yourself, does it make sense that you should be comfortable with dying from a medicine? When someone dies from a medicine, it should be just as significant of an event as dying from a vitamin. You need to become less comfortable with side effects of medicine and medical procedures. Okay, so how can you ask this question with a little bit more gracefulness? Try this. Excuse me, doctor, can you go over the side effects and likelihood of a negative outcome to this medical procedure or medicine? Don't be surprised if your doctor doesn't know. If that is the case, it is your responsibility to find the answer before you go forward. Okay, on to the next question. The response you received from the first question will perhaps eliminate the need to ask any other questions, unless you accept or are comfortable with your chances of dying. Hopefully, you are no longer comfortable with that outcome. However, if you are going forward, the next question is just as important. Whenever you seek health care, more than likely you have a symptom or a health concern. Your practitioner is going to recommend a treatment, procedure, or a medicine. You want to ask this important question. Can you guarantee me that I will not be made worse? Here we go again. Unfortunately, this question is usually avoided, sometimes at all costs. You see, there aren't any medicines or medical procedures that can guarantee you will not get worse. All medicines have side effects. All procedures have the possibility of going awry. And all patients have been made relatively comfortable with the potential for negative outcomes. The real question is, are there better options that will not make you worse? So far you have been told that no medical procedure or medicine is safe enough where you can be guaranteed it will not kill you. Now you will be told that there is always a chance that you can be made worse. You may not have thought about this before. However, even a successful medical procedure results in unintended damage to your body in one way or another. Medicine and medical procedures all alter your body's normal function, whether it is a chemical or a procedure. So, how can you ask this ever so important question in a way that will not be confrontational, help build your relationship with your healthcare practitioner, and may even help reduce the stress on that individual? Well, how about this? Excuse me, but I'm interested in what are the possible side effects that can arise from the medicine or medical procedures. Can you tell me some of the most common and even least common possible side effects? Once again, don't be surprised if your practitioner doesn't have a good or a complete answer for you. You will have to investigate this on your own, even if the answer seems plausible. No one can remember or know everything. When it comes to assenting to take a medicine or have a medical procedure, you need to be fully informed and educated. Okay, maybe you made it this far. Maybe you haven't been scared off yet. The next question is equally as important. You should always be thinking about your future. I find that most individuals treat these decisions way too lightly. Most patients make decisions as if life is short. Well, if you've not learned this yet, let me tell you, life is long. You have to live with the consequences of the decisions you make today and the side effects of them for the rest of your life. People have been convinced that as they age, they need to become comfortable with the idea of a progressive downturn in their health. Decreased function, then loss of function, and even disability are all likely in your future. This does not have to be the case. And the answer to these questions can make all the difference in how you live out your long life. Hence, the third question. This may not be the last question you ask, but it is as important as the first two. Ask your practitioner this: can you guarantee me that what you are suggesting will result in me being healthier? Most, if not all, patients, when they enter a healthcare facility, have a goal of resolving their symptom and restoring their health. You probably have never thought about it in any detail before, although I am sure you're perfectly aware that there are no medications that restore and improve your body's physiology and function. All medications alter normal body physiology and normal functions in order to change a symptom or a test outcome. However, when it comes to medical procedures and surgeries, you may have been told or you may have been led to believe that the outcome results in a healthier you. Upon further analysis, you will find that, like medications, medical procedures and surgeries result in altered body function, not the restoration of such. Think about it this way. If you are currently suffering with a symptom, illness, and disease, and you opt for a treatment program that utilizes medications, medical procedures, or surgeries, are you restoring your health? We already discussed how medications have side effects, how all surgeries have potential negative outcomes. You may respond, yeah, of course, but what if you have a positive outcome to the surgery? The answer is quite simple. All surgeries result in secondary damage to your body. You will have adhesions, scar tissue, and potential nerve damage. And those are just some of the possible side effects or long-term results. For at one point in time, earlier in your life, the symptom, illness, and disease did not exist. The medication, medical procedure, or surgery does not restore you back to that point in time. Your goal should be a healing approach to restore your health and repair the damage. I truly believe that most patients enter their medical facility believing this will eventually be the outcome. However, you soon find out that the only mode of treatment are medicines, medical procedures, and surgery. If you dare apply common sense and analyze the situation you're in, you may find yourself questioning why you have been on the same medication for years and why there has been no discussion, focus, or effort to restore your health, help your body heal, and repair the damage. If this is truly what you are interested in, let me introduce you to an innovative new way of healthcare. You can look at our website and gather more information at www.drwilliamschneider.com, www.drwilliamschneider.com, or simply give us a call at the Pain and Wellness Center in Warren, Ohio. You can call us at 330-372-7246. Thank you very much, and hopefully asking these questions will change the way you look at your healthcare system.